Good evening, ladies and gentlemen. Welcome to usmlevideos.net. As usual, we discuss a new topic every day on this website. If you are interested to receive a new video in your mailbox, just go to our website at www.usmlevideos.net and enter your email address so that we can send you a daily video in your email. Tonight I want to talk about informed consent, the doctrine of informed consent. In fact, this is so important all through your medical profession. I mean, every day with every patient, you need to think about this doctrine of informed consent. Informed consent is before any procedure, you counsel the patient about the reasons for the procedure, alternatives, and the risks and the benefits. And this topic is so important for step 1, step 2, step 3, and clinical skills. Now, let me give you what are the major components of informed consent. It is basically the counseling, and it is the main part of patient communication. In this, you always make sure that the patient understands the information and assesses the treatment choices and expresses a preference to a particular treatment. For example, you got a patient with pneumococcal meningitis, and the option before you is to use an antibiotic. And you need to discuss that with the patient. You don't just discuss the benefits of it, you should also discuss the risks of it. For example, you need to tell the patient that these antibiotics are associated with antibiotic associated colitis, Clostridium difficile infection. You might get this infection. So you discuss with the patient. Alternatively, you can choose not to treat this infection. In the same way, for example, a patient came with uterine cancer. You need to talk to the patient. First, you need to tell her the situation she is in. This is uterine cancer. You have this much chance of dying if we do not treat this. Even with treatment, if we treat you with the surgery or radiation or chemotherapy, these are the risks of death with each, and these are the risks of morbidity. So you always discuss both the positive points and negative points. Now, the central features of informed consent are mutual participation. In fact, you are telling the patient that you respect their autonomy. It's not just you are rubbing your wishes on the patient, but you are giving the patient autonomy to choose whatever he or she wants. Then you are also showing mutual respect. You are respecting patient. You are respecting him or her as a person. Then it facilitates communication. You see, many times we just treat people just like cases. We worry more about medications we have to do, the consultations we need to make, rather than worrying about how the patient is conceiving the whole situation. That's why informed consent helps to establish a proper relationship with the patient to communicate well. And the other thing is shared decision making. Now, you are not the only person in the decision making when it comes to patient health. You are giving an opportunity to the patient in order to participate in his health setting. So it is the shared medical decision making. So in informed consent, it facilitates that process. Now, it also helps to form a therapeutic alliance with the patient. That means throughout the process, you and patient, you are making decisions collectively. I mean, it is not just signing a sheet of paper and keeping in the patient's file. That's not what informed consent means. Many people think that informed consent is simply giving a form to the patient. Patient takes it and signs the form and gives it back, and you keep it in patient's chart, and the informed consent is over. But that is not what is informed consent. That is only a very, very minor part of informed consent. Informed consent is communication with the patient verbally. You are informing the patient about his current status, about his treatment options, about the alternatives he has, about the risks and benefits and outcomes of those treatment options. And you are ultimately giving an opportunity to the patient to decide. That is what is informed consent. And now let us see how informed consent works. For example, a patient came with insulin diabetes, insulin dependent diabetes for many years, and he is not taking his insulin well. And now you want to insert an insulin pump into his body. For that, you need an informed consent. And before you take that consent on a paper, you sit down with the patient and explain to him the side effects of that insulin pump. It might cause hypoglycemia. You're always at the risk of hypoglycemia with an insulin pump if you do not adequately eat. So that is the major part. That is sitting with the patient before you do a procedure and talking about him. So the most important things here in informed consent are you talk about the patient's current status, then you talk about the interventions, then you talk about alternatives, and you finally give your own recommendations. You would tell the patient, if I were you, I would do this. And you give an opportunity to the patient to make a decision in a comfortable way. And you should always check for their comprehension. Many patients do not understand the vocabulary we use. That's why in the informed consent, you should always use the street language. You should not say hypoglycemia. You should say low blood glucose level. You should not say hypertension. You should say low blood pressure. You should not say carcinoma. You should say cancer. So these are the terms you should use so that facilitates patient comprehension. This doctrine of informed consent, that's why, is very important in all your steps. In fact, that is very helpful even for your future, because so many medical legal cases, malpractice cases, they happen due to inadequate communication with the patient. And informed consent facilitates good communication and reduces the risk of being sued by the patient. I hope this helps, and please visit our website at www.usmlevideos.net, and you can actually browse through hundreds of videos on different subjects that help you prepare well for USMLE examination. And you can also subscribe to our USMLE video of the day. Thank you. Have a good night.